know where Gail is.
Hi.
Hi, I don't know where Gail is, so, I sent her a text, but she didn't respond. There's a bunch of people in the waiting room, Ilka.
28.
Whoa.
So, I guess we should get started, right?
Yeah, I think it's sorry. I'm sure.
Yeah, I guess let them in.
A couple of minutes, but
What?
we should join in a couple of minutes, but we should just get started. It's like so many people, so.
Yeah, all right, if you could let them in, that'd be great.
Okay. All of them.
Okay. Everybody, we're gonna give it one more minute and then get started. All right. Okay, I think we're gonna get started, everyone. Welcome to our Tuesday task force. So Gail will be joining us shortly. She's running a little bit late, but we'll get started. So in our task force, usually we focus 1 week on the COVID vaccine and then the other week on reopening, and we usually alternate weeks, but today we're going to do a little of both. So that'll be interesting. On the vaccine front, we know that our numbers are still low, but we've seen a slight uptick in the past week. And then globally, we've seen the Delta strain starting to wreak havoc in various places. And of course, we're still challenged to make sure that more and more people get vaccinated. So that's going on. We'll address those issues. And then on the reopening front, the city budget passed last week. There were hundreds of millions of dollars in federal stimulus money. And we know that the mayor has declared this summer, the summer of New York City. There's big concerts in Central Park. There's a lot of events planned. We heard about a month ago from NYC and Company about all their plans for drawing tourists back. And at the same time, of course, we're grappling with, big train delays that we've heard are caused by the thinning MTA workforce. We still have some street issues with litter and quality of life issues. And there was a lot of gun violence this past weekend. So we have a lot of work cut out for us, even as we had all this extra money to spend. So we're going to try to look at both those issues in this meeting today. But we are very, very excited and to have Dr. El Sadir join us again. We were sad last week that our timing just didn't work out well, and we kind of messed up the timing. But Dr. Sadir agreed to join us again this week, and we're very thrilled about that. Columbia is planning a pandemic research center that she's working on, and I'm sure people have other questions as well. So I know Dr. Sadir's on the line. If you want to just take it away, and thank you again so much for joining us. We appreciate all you do.
And thank you for inviting me again. And I apologize last week because I had to run to another call. So apologies. I don't know. I thought I would start by maybe giving a little bit of a sense of where the city's at in terms of COVID-19, and then I guess you want me to take questions, right? I'm assuming. Does that make
Mhm. Sure.
I think as you mentioned, I think we're in a tenuous moment at this point in time. I think we have good news, obviously, in that the numbers of COVID-19 cases have been low, about 200 new cases per day, which is very good news. And the percent of people who test positive has been less than 1%, which is also, of course, good news as well. And then we continue to see more people getting vaccinated in the city, which is also important. And certainly access to vaccination has improved substantially from the very rocky start that we had here in the city at the beginning of the vaccination campaigns. I do think there are some things that we should be vigilant about and concerned about. And COVID is not behind us. I think this is really important. It's not something of the past. I think we need to be cognizant that COVID is still around and the virus is still around, and we have to remain extremely vigilant. And why should we be vigilant? I think for a couple of reasons. We know that, for example, when you look at positivity of the testing across the city, it varies substantially from one zip code to the next zip code, and also from one borough to the next, with some areas that are testing at much higher levels than other areas. We also know that the vaccination uptake is similarly also varies substantially from one zip code to the next and from one borough to the next. And we know at the same time that we also have the new Delta variant, which is a new strain of this virus, that what we know about this for sure now is that it is more transmissible, meaning it's easier to be transmitted from one person to the next. So the concern is that since we have these communities where we have low vaccination uptake, is then that these communities then have the potential where we might see surges with this new variants, because a large proportion of the people are not protected by vaccination. Another thing to keep in mind is that the pace of vaccination has slowed substantially, as you all were aware, and also the pace of testing has also decreased, which is also worrisome. Because you really need the testing to be there so that you can identify people who are positive, so then you can do the isolation, the quarantine, and so on. So there's good news, but there are also reasons for being very cautious moving forward. And there's the need for us to be incredibly attentive to what's happening, to continue to support people, to get them to be willing to be vaccinated and to make it as easy as possible for them to get vaccinated, while at the same time to also continue to invest in the testing and the contact tracing and so on, so that we're able to catch infections as quickly as they appear, so we can stop transmission further. So maybe I'll stop here and take questions.
Oh, Dr. Sadia, thank you very much. I know that you are always available, and I deeply appreciate it. I think one of the questions is maybe there are other places in the world where you have studied that are good at getting more people to get vaccinated, because people have many reasons not to. Do you have any suggestions along those lines?
Well, I think that based on my experience working, here and around the world, is that what it's going to take, there's not going to be one magic bullet. It's going to take trying different things, and that's what I strongly suggest, is to try different things, and then don't give up. Like if you try one thing and it doesn't work, one should never give up, but try something different, to try a different approach. So for example, the idea of taking the vaccine out to people rather than expecting people to come to the vaccine is very important. Making it as convenient as possible, so that people don't say, I don't have the time, or I can't take the time, or I don't have the money or the resources or to get to where the vaccine is. So this whole idea of making it as easy as possible for people who are willing to be vaccinated to get vaccinated, bring the vaccine to them. rather than expect them to come to us. I think that would be a very important principle. And then the second is to answer people's questions as honestly as possible, tell them what we know and what we don't know, and to share the information and update it as you do with these calls, these amazing calls. To share valuable information is very important. And then I think thirdly is, of course, to use the community assets that exist in our city. The city is very rich in community assets, whether it be community-based organizations, religious organizations, and other social organizations, to be able to utilize these assets as much as possible to reach their constituencies is something that I think is also incredibly valuable as well.
I think people have been trying. Some of them, like you said, work, some of them don't. I know I've been to several of the parks in Harlem with the bus, and people are so nice in terms of the staff, but the numbers are like 20 a day. And that's hard when you're there from 9 until 8 o'clock at night, and music and food and everything.
Yeah.
But it's not happening. So I think you just have to keep trying. There's no question about it. I could go on with questions. Does anybody else? You could just start talking. This is a doctor of astronomical proportions, and we deeply appreciate it. I think the other question, of course, which I think you touched on in terms of the Delta strain, we're told that the current vaccinations or vaccines are effective against it. Is that true?
Yes, we're very fortunate to have these vaccines that actually look like they're really good against the Delta variant. So that's an added message that I think we can add to our armamentarium of the messaging that we tell people, is that not only are these vaccines protect against the early strains that existed in our city, but these are also really good at protecting people from this new strain, the Delta strain. So that's an added advantage. And I think the other thing is that that's not the case around the world. And that's why I feel like it's really important to keep reminding people that we're an interconnected world, and it's the vaccines are our most critical now line of defense against the Delta strain, as well as the potential introduction of potentially other strains as well. So I think it's really important to use our main now armor against this virus, which is the vaccine.
All right, Dawn, you had a question. Go ahead, Dawn Grisham.
Thank you, Borough President. And thank you so much, Doctor, for being here. It's so helpful. I'm wondering if you have any thoughts as to what COVID numbers we would want to take seriously in thinking about recommending or requiring mask wearing, at least in indoor settings. So for example, if we reach a certain positivity level, if we reach, or a certain number of cases per day, hospitalization, whatever you would consider important to pay attention to.
Yeah, I think this is another excellent question. And as you are probably aware as well, is that there are these milestones that have been set by the city in terms of milestones to keep in mind that we want to stay below them, right? So for example, we want to keep the hospitalization rate. Now it's at less than 2 per 100,000 population, right? So we want to keep it at that. So I think that would be something to keep in mind. We want at all costs to keep our hospitalizations below that important threshold. Similarly, another as well is the numbers of new infections per day. And again, the city has also put together a threshold to be less than about 550 new cases per day. We are about 200 cases per day now. And then in terms of the testing and the testing, the percent positivity, I think again, the importance is to keep it less than 5% positivity. But I would say none of these magics and these thresholds there's nothing magical about them. The most important thing is to watch the trends, okay? The trends meaning the change over time. That's very important to keep an eye on where we're at today, where we're at yesterday, and sort of keep an eye on whether the trend is we're stable or the trend is going up or the trend is going down.
Thank you. Alexa Hirsch, go ahead. Alexa?
Hi, sorry. I'm Alexa. I've been to these meetings before. I'm a student at Barnard College. I'm a rising junior, and I work in the office of Assembly Member Rebecca Seawright. I asked this question last week, but there was not a doctor on the call to answer the question. So my question is, how accurate, okay, because last week there was someone, I can't remember who it was speaking, posed that in order to get into certain events, you either need to show a negative COVID test or like a vaccine
Yes.
card. My question is, how accurate is a negative COVID test? Because I was exposed to COVID and then I didn't test positive for 5 days. So is that accurate?
Yeah, yeah, it is. Let me tell you what happens after somebody is exposed to COVID. What ends up happening is that if somebody is exposed to somebody who has COVID and they get the virus, it takes it takes an amount of time before there's enough. The virus is multiplying enough in the nose, for example, or in the mouth to be able to actually test positive. Okay. So it's not there's something wrong with the test, is that it takes time to be able, from the moment when somebody's exposed to someone, to getting a positive test. And it can vary substantially, depends how much virus there was in that exposure. If somebody's exposed to a whole lot of virus, then they would have a short period of time from that exposure to getting a positive test. So it really varies substantially between individuals. So the idea is that what you're trying to do by requiring a negative test is, at least at that, all you can say is at that moment in time when that person got the test, they didn't have enough virus in their system to test positive, which means that they probably had low amount of virus, which is good because that means then they're not as transmissible. They're not as likely to transmit to somebody else.
Okay.
Thank
Billy, go ahead. Billy Freeland.
Great. Thank you so much for being here with us. There's an op-ed, I think, today in the Times about the weighing vaccination versus not getting vaccinated for children. And I imagine, particularly as we go into the fall and vaccination opens up for kids who are 12 or younger, we're going to have this debate about hesitancy and parents weighing the risks again. And what the op-ed concluded was that the risks of not getting vaccinated are far greater for children than any potential side effects to being vaccinated. How would you recommend we sort of message and speak to our neighbors, particularly parents who are worried about their children getting vaccinated? What have you found to be effective messaging, and how much of this is about here's what the science show, here's what the data show, versus, I don't know, perhaps less science and data driven messaging that perhaps could be more compelling to people?
Yeah, I mean, it's a very good question. I think the study, as you know, the studies are ongoing now to look at vaccines for those who are less than 12 years of age, right? So that the research is ongoing, but hopefully within the next several months, we will get the answer. I mean, I find that probably as a parent, certainly is that probably for parents, the most important thing for them is to protect their children. I mean, that's kind of the most, the strongest probably human emotion that exists, apart from self-preservation maybe, but I think even preserving one's and protecting one's kids is even probably stronger than that. And I think the messaging has to be is to share the data with them and tell them that that this was done in X number, the studies were done in a lot of kids, and that the side effects were minor, and that the benefits are substantial. And I think to keep saying that if you want your child to be protected, as we want ourselves to be protected, the vaccines hopefully will be the best way to do so. It's much better than, as you can imagine, asking a child to continue to wear masks is very difficult, especially in the context of schools and camp and playgrounds and so on. So if they want their children to have the best possible experience in their school, it will have to be dependent on vaccines as their main source of protection.
Okay. Chris LeBron and then Jimmy Sung. Chris?
Hello, sorry about that. Getting used to the new Zoom layout. Thank you, Borough President, for hosting. It's my first meeting. Quick question to the doctor. How important, so I live in Hell's Kitchen. I live a block away from Times Square. It's a primary location for our city's, revenue. How important is it for us to start promoting vaccine tourism to those who are coming from abroad and within the country? My neighborhood has the highest number of men and women living with HIV, and we're a naturally aging community. What's the importance of working with hotels and airlines to make sure that like people who are coming here have access to the vaccine?
Yes, I think I am certainly supportive of, as we say, we need to think about vaccinating our own communities, but also it is just equally important to vaccinate the world because we are an interconnected world. And I always say COVID anywhere is COVID everywhere. And I do believe that New York City has actually put in place now the possibility for anyone, they don't have to be a resident of New York City or a citizen of this country, to be able to get a vaccination, which I think is a very good policy, because in many ways, of course, it protects these individuals, as you know, if they're here for some time. Obviously, you don't get protected from a vaccine overnight, but ultimately, if they're here for a while, they will get protected. And also as well, when they go back to their country of origin, that means that we are contributing to also this effort to vaccinate more people around the world. So I think it is a good idea to do so, and hopefully this can be taken up by many of the visitors who are now being encouraged to come to New York City.
Thank you,
Just
Jimmy.
Thank you so much.
All right, Jimmy Sung.
Hello. Hi, my name is Jimmy Sung. I'm a community physician. My question is to the doctors. Do you think we have plans for the next outbreak? Are we ready? Do we learn anything from this experience? Do we have the infrastructure to, number one, try to prevent another outbreak? Number two, if it does happen, we can control it better. Number three, vaccination. Are we going to still use the same website?
I mean, maybe I can start from the end. I think the vaccination, yes, we need to continue every effort for vaccination. There now, people can walk in and get vaccinated, so they don't need to go to the website. They don't need to have an appointment. So it's become much, much simpler than it was early during those difficult beginnings of our vaccination efforts in this city. So now people can walk into vaccination sites. They can walk into their provider's office and get vaccinated. If their providers are offering the vaccines, they can walk into drugstores, pharmacies are offering vaccines without appointment. So access to vaccination. And then there are the vans that Borough President was mentioning, about the vans that are also in the city as well offering vaccines. So there are a plethora of ways, many, many different ways of getting vaccinated. So that's.
I understand. Perhaps I should clarify a question. My question is, are we ready for the next round?
Yeah, I'm getting to the next. Yeah, I was answering your vaccine question at the end in the website. In terms of the, are we ready? I think we have learned an awful lot. And remember, we've just been through a surge over the winter holidays in terms of an increase in numbers of cases and so on. During that surge, fortunately, even though the numbers of cases were quite large, but fortunately, again, we did not experience the hospitalizations and the deaths that we experienced in that very first painful wave last March. There are many reasons for this. One of them is clearly the health system is much more adept. Clinicians like yourself are much more aware of how to manage cases of COVID-19. People are much more aware about how to identify symptoms and go and seek care for COVID-19. And there also have been as well more collaborations built across institutions in the city based on the lessons we've learned from prior surges. I do think moving forward, I'm hopeful that with vaccination now, And especially if you continue to get more uptake of vaccination, we will be hopefully protected from experiencing the kinds of surges we've experienced before.
All right. There were some questions from Bob, which I can relay. He's a member of the community board. One of them is, the vaccinated people, will they need boosters? Are boosters being developed was one. And also, I know there's some people who have situations where they're, understandably concerned about unvaccinated children and if they can interact with them. So those were two questions.
Yeah, let me start with the boosters first. And here again, there's good news, is that now the information we have that are accumulating over time is that the protection from these vaccines are long lasting, which is really good news. There was first people were afraid that people would be protected only for a couple of months after they get vaccinated. Now we're seeing that there's a durable protection. That's very good news. So that means that we don't know when we'll need a booster or if we will need a booster. I think this is really good news. The other thing is that having vaccines that work against these new variants like the Delta variant also is reassuring, which means we don't need a booster for the Delta variant. So I think both the information about the longevity, the long-standing protection, as well as the ability to protect against Delta strain, again, are all good news. And again, they tell us that we don't have to worry as of yet about the need for a booster. Now, in terms of children, I think that as you are aware, the more the adults around these children, if they're vaccinated, then they are protected from getting the virus. So the risk of them getting infected is quite low, which means that again, they're likely, there's a very small risk of them transmitting to their children.
And then one other question I have from Caroline was, I don't know exactly what this means. Are breakthrough cases being tracked? So I didn't know what that meant. Is there data on these?
Yes, there are. A breakthrough case is a case of if somebody who's been vaccinated who gets infected with COVID-19.
Got it. Okay.
We know that the vaccination these vaccines are fantastic, but they're not 100% protective. So there's still going to be a small group of individuals who may get infected even though they're vaccinated. What we do know is that for people who do get these breakthrough infections, who get these breakthrough infections, is that they tend to have either no symptoms at all or mild symptoms, which is very good news. And they also, what we've learned is that they're also less likely to transmit to other people, which means that these vaccines also decrease the amount of virus. Even though somebody can get infected, the amount of virus that they're shedding is low, which means they also are less likely to transmit. So that's good news. So the breakthrough infections are rare. They can happen. And that's why it's important for people, if you've been vaccinated and you develop symptoms, please do go and get tested, because it's not impossible to get infected even if you've been vaccinated.
Okay. And then the final question that I have is, FDA is going to make emergency go away, and this is permanent, and then it comes with a new set of very positive regulations. Do you have any sense? I don't know why you should, but you know everything, Dr. Elson. When we might end up with what I'm trying to describe, not clearly.
Yeah, no, I think people have been waiting, as you know, because we've had this emergency, this pandemic.
Yeah.
Thankfully, the FDA has had the system to be able to evaluate the studies and give us this emergency use authorization, the EUA, which is exactly what you need to do in the time of an emergency like the one we're experiencing. At the same time, these vaccines have been submitted to the FDA to review in order to get full approval for these vaccines. And people are anticipating that over the next few months that these vaccines will receive full approval.
Okay. Faye, you have the last question because this poor doctor's been with us so long. Faye, go ahead.
Thank you, Madam President, and hello, everyone. And thank you, Doctor, for, sharing this interesting, information. So my question is, what would be your suggestion or advice for parents who are still undecided in which vaccine would be best for the children? And also, what would be the difference? That's question number one. And the second would be if there is any difference for parents taking what type of vaccine or the vaccine that they would choose for their children. Like they feel some of them, well, we hear so many things, but you have parents thinking that the vaccine that children are taking, it's different from the adult. Perhaps children might be more affected than adult, and then it's a big confusion on these issues. And maybe I should add a third question is that a lot of folks feel that doctors are not speaking about the issue that some people are dying as a result of the vaccine, but I don't know, that has to be with underlying condition or so forth. But if you can speak to this issue, it would be very, educational for myself, and so I can actually go back and answer those questions for them.
Thank you.
And thank you again for, for this presentation.
And thank you for your excellent questions. And let me start first for children. The only vaccine that's now authorized for use in children from 12 to 12 and up is the Pfizer vaccine. Okay, so keep that in mind. That's the only one that we have yet, that we have at this point authorized for these children. So that's the Pfizer vaccine. As I mentioned, we don't yet have vaccines for the less than 12 years of age. Okay. Then the other question you mentioned is about, all these reports of somebody got vaccinated and they died. And I think you provided a perfect answer, which is, often these same individuals may have had an underlying condition. For example, they may have been ill with something else, and then they get the vaccine, and then sort of as a coincidence, then they may die thereafter. It doesn't mean that the vaccine is the one that caused the death. It may be the underlying condition that actually was the one that resulted in unfortunately their loss. So we have to be very careful about, attribution, what I call attribution, attributing that a bad event must have been due to the vaccine. I mean, the most extreme examples I can give, if somebody, if I go to get vaccinated today, and I get vaccinated, and then on the way out, I trip and I fall and I break my leg, for example, then the vaccine is not the one that caused me to break my leg. It's something else. So I think we have to be careful when we hear these things, to dig deeper and try to understand really where was that person, what was their situation, and were they ill from other conditions and so on before one makes that connection to the vaccine.
I want to thank you, Dr. Eltagar. I have to say that in all of our experiences, nobody's clearer, nobody's makes it understandable more than you do. And I wish you the best of luck with your research center. It's very exciting. I know it'll be successful because you're involved. So many, many thanks from all of us, the whole city of New York. I can only speak for Manhattan, but I'll speak for the whole city. Thank you very, very much.
Thank you, and thanks to everybody, and thank you for all your work. Thank you. Bye-bye.
Thank you very, very much. Okay. All right, so our next speaker, as I understand from Jessica Mates, is the great Preston Nee Black, who's Deputy Controller for the budget. He's recently, also some years ago when I knew him, was in charge of the budget council, and he is incredibly knowledgeable. So if Preston, if you don't mind just sharing with us whatever you want, some of the stimulus money, what's happening moving forward, what happened in the budget, whatever you want. We really appreciate your time.
Okay, sure. Hi, Gail. Congratulations. Looking forward to having you as my council member again. Yeah, so the budget for this current fiscal year 2022, was adopted last week. The fiscal year starts on July 1st. And I guess the thing that's probably most striking about this year is just how good it is compared to what we thought, how things looked 6 months ago. The budget is funded with a very substantial amount of stimulus money, of course, and I'll talk a bit more about sort of how that's been put to use. But we've also done better in some of our tax revenues than we expected. We are taking in about $1.6 billion more in personal income tax revenues than we had expected 6 months ago. And there are a couple of reasons for that. One is that it's been an extraordinary year on the stock market, and so all those capital gains get taxed. You could argue that maybe they should be taxed at a higher rate, but they get taxed. And the other thing is actually when the pandemic first began and we had the shutdowns that closed down so many businesses, I think people didn't realize right away what kinds of businesses were most, and individuals, what kinds of jobs were most affected by that. And it was not high earners who can work from home because they work, in an office on most days. It was frontline service workers who, do everything from make sandwiches to provide childcare, to check you out at the grocery store. All of those people suddenly lost their jobs. And so the loss in income tax revenue was actually not as bad as the job loss was. And that was sort of ironic and unfortunate side effect, I guess, of just the nature of this pandemic and how we responded to it economically. Hey, sorry, my dog is chewing on something loud. The sales tax, on the other hand, has been dismal. We're now down $1.4 billion, or about 17% compared to what we took in 2019. When you look at the sales tax and sort of the composition of what people pay tax on, so much of it really is in restaurants. You also pay sales tax when you stay the night at a hotel, and of course on retail. And all of those were closed down. And so we had a big loss in sales tax revenues. But the other thing we've kind of realized when we looked at it more closely is somewhere close to 25% of our sales tax revenue really comes from commuters and visitors. So people coming into the city for work, people coming into the city on business or for tourism, and those people stopped coming in, and that has really devastated our sales. So it's been a mixed story, but overall we've done quite a bit better. And in the year that just ended, we generated a very substantial surplus, $6.1 billion, and $6.6 billion actually. We used $500 million of that to put into the recently created rainy day fund, which was the first time we put a discretionary deposit into that. And use the rest of it to prepay some expenses for this current fiscal year. So the total budget, when you take into account all of those use of the surplus there, the total budget for this year is $103.6 billion. And it has not gone down entirely because of the use of federal stimulus money. So let me talk for a moment about that. In the mayor's executive budget, the budget that was the basis for negotiations with the city council on the budget that was just adopted, the mayor allocated some $15.7 billion over 5 years from fiscal years 2021 through 2025 in federal stimulus money. Most of that came from two big sources, really. One was from the President Biden's American Rescue Plan. There was about $5.9 billion that was pretty much usable for anything we wanted. And then there was an amount from that plus from another stimulus act in December that funded education spending. So altogether, most of that money is allocated for kind of recovery, what I'll call coronavirus recovery and response needs in this year and last year. It's helped pay for, the mayor created a rental housing assistance voucher program. We have a large number of school programs to help with learning loss and emotional and mental health needs of students who've been out of school for so long. a lot of testing and tracing and vaccination programming. The mayor created a cleanup corps to hire 10,000 people to help address street cleanliness in the city, a small business grant program, et cetera, et cetera. So really a very, very substantial range of uses. Excuse me. Then there was some funding that was used, I would say, primarily for just straight budget relief. So to sort of offset city, to help support basically city spending in various agencies. That altogether was probably about, let me just look here for a minute. Oh, I see. Probably over $2 billion. And then some funding that was used to restore some cuts that had been proposed primarily again in the Department of Education. So a lot of programs, the mayor's equity and excellence initiatives, the arts education initiative, et cetera, were all refunded again using federal stimulus money. I think one thing that has been of some concern to a number of observers has been the sort of number of new programs that were funded, or existing programs that were expanded using stimulus money in ways that will require us to identify city money once the stimulus funds are gone. The use of stimulus funds is time limited, so we can't, we're not gonna have it forever, obviously. And so there are a number of programs that the mayor has proposed expanding, which will need funding once stimulus money is gone. The biggest of these is, of course, the 3K, universal 3K. There are a number of mental health programs. There's funding for nonprofit overhead. There's funding for senior centers. There are just, again, a big range of programs that are funded using stimulus money that in 2025 will sort of run out of funds, and we'll have to find some other source of funding. And at the end of the day, the mayor has really not done a lot to address the gaps that continue, the budget gaps that continue in the out years of the financial plan starting in 2023. So between now and next June, when we pass the budget for fiscal year 2023, which will of course be the new mayor's budget, we're going to have to figure out how exactly we're going to start to address those budget gaps. So that's kind of the big picture, and I guess I'll just stop with that, and I can answer whatever questions people have.
People should sign up or jump in. Mine is the Jim Karras, Gail Brewer question. Are we ever going to get units of appropriation? U of A. What that is, so people know, is it breaks down so that you know what's in the program. Because right now, $10 million, other, you have no idea what's in that. Go ahead, Preston. Makes me crazy.
Yeah. I mean, the de Blasio administration has worked with the city council and has added some new units of appropriation that, were for a long time resisted when you and I were at the city council, Gail. There's still, just looking at the budget that was adopted, there are a lot of changes, and there's sort of in the brief overview, there's kind of this big lump sum called agency expense changes. When you start to dig into that, you realize that there are all kinds of sort of puts and takes, and new spending and savings and money rolling over from one year to the next. It really is not transparent. So I don't really give this administration the high marks for transparency in budgeting. So I don't know. I guess when you're mayor and I'm your budget director, Gail,
No.
better units of appropriation.
Okay, so there was no major change in terms of that issue.
No.
All right. I could go on and on about budget, so somebody else should jump in, because this is what I love doing. Are there any, here are some questions here. What the issue, of course, with the stimulus money, this is from Bob, also from Board 1. When the eviction moratorium ends, do we have any sense of what that money is going to look like, or are we going to have enough to meet the need, and so on and so forth? That is a big, big question.
Yep, I didn't really talk too much about the state budget, but the state budget also benefited from a lot of stimulus money, $12 billion, and another, I'm going to say $4 billion in tax increases. So there was among other things, there was a big fund that was created for emergency rental assistance. And that essentially was primarily to help meet rent arrears. So if you hadn't paid your rent or all of your rent for some period of time in the last, or over any time over the last 12 months, you were eligible and you met certain income criteria, you were eligible to apply. And the state would essentially write a check to the landlord to clear your rent arrears, and would also do that going forward 3 months. Landlords had to accept certain conditions, one of which is that they would not evict you for, I believe it was 6 months. I'm not sure I remember that correctly, but for a period of time, there was no eviction at all, and you could only evict people for substantive causes after that, other than non-payment of rent. So there is money available through the state to address that. I'm not exactly sure what to expect, honestly, when the eviction moratorium ends. There's still a lot of people, there's still a lot of jobs that are unfilled, and still a lot of people out of work. But the unemployment rate is coming down. More and more jobs are getting filled at a sort of accelerating rate right now. So I'm hopeful that by the fall we will be, if not back to where we were, at least a lot closer to where we were prior to the pandemic in terms of employment, which was we were in historically excellent shape. We had an unemployment rate of 3.8% in the city, which was a record low in the last 40 years.
Okay. Faye, go ahead quickly, Faye.
Thank you. And thank you, Councilmember Niblack. Yes. Well, we know, where the funding, is going to be designed. So it captivated my attention that the $6 million that will be put aside for rainy day. I wonder if you can give us an example of rainy day funding might be used in case of emergency or anything like that, I guess. But I also wonder that if you can tell us, so if that rainy day may have a deadline to undo the turn on day, and if in case that this funding are not used, what then you will do with that funding?
So there's good questions. Just to be clear, the surplus from last year was $6 billion, most of which was spent to fund this year's budget, which is why this year's budget actually grew. We put now altogether in the rainy day fund that's newly created $1 billion. Take that over there. Sorry. There are some other reserves that are set aside. There's budgeted reserves, et cetera. So altogether, something close to $5 billion sort of set aside. Typically, some of that gets used during the course of the year to help fund any deficiencies that need to be met. But in the legislation that created the rainy day fund, the formal rainy day fund, the mayor is allowed to take up to half of the amount kind of at his discretion. Now, of course, that means that there will be a negotiation with the city council about it. But, some people like the Citizens Budget Commission have argued that we ought to have more stringent rules about when the money can use and how much money you have to put in. That's not the case right now. So it's all pretty discretionary And the mayor and the city council can use those funds, at least half of the amount as they see fit. Anything more than that, the mayor has to declare kind of an emergency. So it's a bit of an experiment. We haven't really done this before. We haven't had one of these before. So really, we're going to have to see kind of how the mayor and the next mayor really will handle it. As I said, one of the things that concerns me somewhat is the fact that there are still despite all the stimulus money and despite our finances kind of returning to better shape again, that we still have some big out-year deficits that we need to address, and that's going to be an issue the next mayor is going to have to start to tackle right away when he or she takes office in January.
The other issue, I'm sorry, but hold on. So the other issue along those lines is, I know we worry about deficits, but this city's gotten so expensive. I know nobody dares touch the property tax for the obvious reasons, very lucrative. But man, is it expensive for people. You got the assessment. I know it's not the property tax increase, but that whole issue just needs some attention. I know Martha Stark has been trying, there's a lawsuit. Do you see any change in that? So that, and I don't know that the property tax is the way to help New York City become less expensive. But
Yeah.
Do you have any suggestions on that? That's such a huge issue. And yesterday's announcement worldwide, Manhattan is the most expensive county in the world or in the United States to live in. It's not very good news, in my opinion.
No, it is a big issue. And the property tax is the one tax that generally grows from every year. It's much more stable than taxes that are more sensitive to changes in economic conditions. That was not so true this year because of the damage, particularly to the commercial office building sector from people not being in their offices. So there was substantial markdown in assessments on commercial properties and to some extent on apartment buildings as well. I don't think anybody should expect a check for a rebate on their rent, but it's a very substantial tax burden on renters, which you don't see because it's just part of your rent. But it increases rents and it adds, as you say, Gail, to the problem of just making the city less and less affordable. The mayor and the speaker put together a commission which produced an initial report that was a really good start in some respects, but whose work kind of got suspended during the pandemic, and they've just started up again with some virtual hearings. I don't know really what the mayor expects to try and do during the next 6 months, but there will at least be some groundwork laid, and the next mayor really ought to pick up the cudgel and move forward. Because as you say, I mean, property taxes are really a big issue.
I think the community boards in Manhattan should pay attention to that also. We've got to find a way to get this borough to be less expensive. The other question, which is a good one, which Jessica came up with, and I think Shula, which is, are you tracking the stimulus money? Who is tracking this stimulus money?
We're tracking it. We don't have like a formal tracker, and I believe that there was a council bill that's been introduced to create a formal tracker. But there was a similar tracking website that was put in place after the 2008-2009 recession for the stimulus, Obama stimulus. It's a very important question because it's a lot of money, and a lot of the purposes that it's being put to are not well detailed or described at this point. So there's a lot of room here I think there's going to be a lot of room for changes also. I mean, the next mayor is going to come in and perhaps decide that some of that money should be spent in different ways, or the needs have changed. So I think it's going to be very important, and it's going to be something that we will continue to watch very closely
Okay. So will your tracking be public, or do you have to have legislation to do that? Do you have?
You don't have to have legislation. I just think, I haven't seen any sign that OMB is jumping up to create a tracking system. We have this thing that was created under Controller Lou called Checkbook NYC.
Yes, I know very well. Yeah.
We're now looking at putting that together to be able to track stimulus funding and how it's being used.
Okay.
Requires a sort of a bunch of programming to get that in place, but I'm hopeful that, over the summer, we'll be able to have that up and running.
That would be very, very helpful.
Well,
Shelley?
President,
Shelley,
Thank
go
you.
ahead.
Thank you. What I haven't heard anything about is housing money.
Yeah.
Okay, in two ways. One, safe, affordable housing is not going to happen without government money. Okay, we get drips and drabs in other ways. And certainly the solution to homelessness is homes. So what happened to that area? In this budget?
The capital budget for affordable housing has expanded recently under the last couple of years here. And part of that was, I think, a critique that a lot of people brought to the about the mayor's housing plan, which was that it was too focused on income categories that were not the most in the most need. So you have, a family where both earners work full-time making minimum wage is only making $60,000 a year. And a lot of people who make minimum wage don't get 40 hours a week. So you have a tremendous need, probably 500,000 households kind of at the very lowest end. And there just wasn't a whole lot of housing being built for those people. So the mayor has put some money in to help expand the construction of housing at that level. Not enough, but it's a step. I mean, one of the things that was possible was to use some of the stimulus money for capital funding, and because stimulus money is one time, right? It's you only get it once. It's great for capital funding because then you spend it once and then you have something that will last. And I think there were a number of areas that were possibilities, including expanding broadband access and housing that were brought up, but the mayor chose not to use any of the money for capital purposes. I see there's a question.
That's really sad.
Yeah, I mean, there were interesting choices that were made about how this money was used.
That's why, Preston, your tracker is going to be more important than ever because it is so hard for the public to follow. Jessica, do you have any more questions? I know you want to know if there were areas that were not adequately addressed, or do you have other questions, Jessica or Shula?
Yeah, I think that was a question, whether, there was so much money put into all these different programs, but are there some areas, whether it's public health or anything else, that really didn't get addressed in this year's in the budget?
Yeah. I mean, there's some of it is, there's a lot of money in there for public health. Most of it is focused on vaccination program, et cetera. There's a lot of money in there still for testing and tracing. And honestly, I wonder whether that money is needed. I don't know how many people are getting tested right now as opposed to getting vaccinated. And I don't think the test and trace core ever really got off the ground. They just never really were terribly successful. So, there is money that's not going to get used, and that could be stimulus money and could be used for other purposes. And I think that that's a really important discussion to have. Probably not with this mayor, but for the next mayor and next year's budget.
Because I love the test and trace people, but neurotic me, I go to all the sites and I see people sitting. I don't see too many customers. So.
Yeah.
I mean, I see them sitting all day long. Okay, Shula, any questions? No. Okay, I think it's 4 o'clock or a few minutes before. I don't know if I don't like to keep this longer than 4. I want to say, Preston, this has been phenomenally helpful, beyond belief. Anything we can do to help with the tracker. I mean, when the staff at Controller Lou did that check thing, it was just really helpful.
Yeah,
And
well,
I hope
you can encourage OMB to fund the $700,000 we requested to expand it. So
I will sort of-
In New
and
York,
they can take some of the test and trace money.
Dr. Stein lets me take care of the business stuff.
Somebody has to mute. You could take some of the test and trace money and put it towards that. That would be very helpful.
There's a lot of detail here that obviously I can't get into. But as I say, we'll try and let you know, Gail, when we have the stimulus tracker up and running and people can look more closely at how the money is.
Okay. And maybe when we do these discussions, you could help just with some slides to show people how to use it, because it really would be community boards in particular. I urge, because all the community boards, Preston, are on one way or the other on this Zoom. And I think they would be really richly supportive. And of course, we have Beta NYC in our office. They do all of the open data discussion with the community board. So between the two, we could really hopefully inform the public. Without that information, it's really, they're not going to know there's so much money. That's why we started these discussions. I am panicked, to be honest with you, that all this money, I can see a lot of this money going back to the federal government in December 24, because we haven't spent it. And, this group right here could spend it correctly. And I know that we have to watch it so it does get spent correctly. It scares the dickens out of me. DOE is getting a lot of money. And yet, when I go to the principals, I say, so how are you doing? Well, the problem, Gail, is we got money, but I don't have any students, because they lost 100 students at every school. So now DOE wants to take the money back because obviously they don't have the students. It's really a revolving door without a lot of information. So
yep,
a tracker would be so helpful. All right. Thank you, everybody. And thank you, Preston E. Black. That was phenomenal. Really, really helpful. Big round of applause for her. All right. Talk to you soon. We'll see you next week. Thank you.
Thank you.